Now we're moving into second and third trimester. And what is the main difference from the physiological standpoint from the first trimester for the woman?
Usually the transition to the second trimester for women is actually something that many women are looking for and they're happy about, because the hormonal changes there, the body starts to get used to it, and in second trimester they're actually starting to feel better, like glow, the pregnancy glow. We move on in the third a little bit later, and I will talk about the second one for a few minutes. Obviously physical changes. Most of the women will show that they have a belly, and also the relaxin, the hormone starts to work through the body, so the connective tissues are softening up. At this time I also notice through the moms who come here either for exercises or physiotherapy that their posture might start to change. They might start to find it a little bit difficult to stay straight and open. Breast tissue increases, normal weight gain happens. They might go into extended back, lordosis, and so on. So postural changes, and the posture is something that I always remind them to watch through the exercises and also during everyday life. As we move to third trimester, these changes become obvious. The belly, quite a bit of strain for back, for the pelvis, again might have a breast increase. Exercise wise, I don't put personally too much differences. Is again up to how woman feels. It's definitely how you feel. So I would say these would be the main changes that woman goes through.
Is there anything that women should start to consider or maybe avoid during the second and third trimester? Somehow adjust probably their physical exercise program.
Well, I definitely would suggest to avoid anything that has a risk of injury. So mountain biking in general. However, there are women who can do that, just to be aware of that risk, obviously. Sports where somebody can hit you, so contact sports probably is avoided. And again, we're talking about, an average population. Also, from the second and third, definitely into third trimester, me personally, although I've seen otherwise, but me personally, I prefer women to avoid laying flat on their back. And the reason is, as the fetus grows, it starts to put pressure on the vena cava, is the vein that runs closer to your spine. That can immediately have an effect on them. They might feel dizzy. If they have a bigger belly, they might feel a little bit sick, because baby also can press diaphragm. So it's not, a very favorable position. So I avoid this position, although there are any other positions they can be in. And again, the running, there has been a research now in England several years ago, and they compared the prematurity of birth related to running, and they didn't find a difference between the time of birth between running and non-running women. So my rule of thumb is, if you did certain sport, your body is used to this sport, okay, like for example running, or maybe you did a HIIT training, adjust it to the level how you feel, make it safe, okay, and then you can continue doing it with some modifications. There are women who went on with the trainers, until 9 months of pregnancy, but with the safe modifications.
Are there any specific exercises that you wouldn't recommend to do during the second or third trimester?
Well, I definitely wouldn't recommend anything that presses a lot of strain on the abdominal wall, something that women might feel uncomfortable. Well, obviously laying on your front even in the earlier days, usually it's quite uncomfortable. Something that re-emphasizes the opening of abdominals, diastasis recti, if you have it, because sometimes it might show. So something that emphasizes this, I wouldn't recommend. Also, if a woman has a pubic symphysis, and let me just say a few words about that, I will use my model. Pubic symphysis is a separation of these two joints, because cartilage becomes soft, or the relaxin is working. It can be quite painful for women, and for some of them it's actually limiting their movements. I wouldn't recommend to do a lot of stretches, leg openings, splits. Even if a woman was doing splits before, try to avoid them. If she suffers from this pain, anything one leg squat, I wouldn't recommend. Anything that provokes this pain, because most of the times after pregnancy it magically disappears. Okay, and you can go back to your normal exercises.
Is there some exercises that you would probably like to show to a woman that would be especially helpful during this period?
Yeah, I would just like to show, a couple of easy exercises where you can activate your core and pelvic floor. And before I do that, I would like to add that when you do your Kegels, for example, or your pelvic floor exercise and your deep abdominals, this is not something that has to be a separate routine. Because who has time? Who has time to lay down and sit and do the Kegels? We want them to do through the day. We want them to incorporate in our existing exercise routine to be more effective and to use our body as a whole unit.
Okay, great. Let's see.
Now I will demonstrate you a couple of exercises that are safe in second and third trimester, and that will help you to activate your deep abdominal muscles, pelvic floor, and also to exercise your legs and arms. For this purpose, I will use the ball. So you place your arms on the ball. Make sure your back is neutral, it's not arching, or you're not tucking your tailbone in too much. And you're breathing in, breathing out, and on your breath out, you gently pull your tummy in and activate your pelvic floor. Breathe in, you relax both your tummy and your pelvic floor. Breathe out, you activate your tummy and your pelvic floor. You might find it in the beginning a little bit hard to find your pelvic floor in this position, but keep trying and you will get better and better. After that, you can also use your side abdominal muscles. Breathing in, breathing out, opening your arm, activating your belly and pelvic floor. Breathe in and relax. Breathe out and breathe in. You can do about 8 or 10 repetitions of each. Also, I've noticed that many women, they find it difficult or they're scared of doing abdominal exercises, especially if they did a lot of abdominal training before pregnancy. So I will demonstrate to you exercises for abdominals that are safe to do even in second and third trimester. They're of a small range, and again, you focus on deep abdominals and on your breathing. So we are sitting here, bend your knees, relax them. Make sure you're on your sitting bones. If this is too hard for you, then you can also put a small pillow. Stretch out your arms in front of you. Gentle deep breath in, breathe out, and a gentle drop. You activate your lower tummy muscles and you don't go too far. You shouldn't feel strain, or you shouldn't feel that your belly is making a doming position. You breathe in and return. Breathe out. Breathe in. You can repeat about 8 or 10 repetitions, and then you can go into rotation. Breathe out. Here, because of the arm opening, you again don't need to drop too far. You're already getting activation of your side abdominals. Breathe in and breathe out. Make sure you do it on both sides. Again, you can repeat about 8, 10 repetitions. And this is very safe way to exercise your abdominals and keep your in tone. Thank you.